You work all your life, you know, and you come to age 65 and you get out of the workforce and you think, oh, well, this time's going to be mine, you know.
4 years ago, Charlie Dawson's hopes for a long retirement were suddenly stopped in their tracks. A routine check had confirmed a freckle on his arm was a Class 3 melanoma.
I thought, well, this might be it, you know, I might be on the way out.
Doctors removed the tumour, but as one of the most aggressive and deadly of skin cancers, that was only the beginning.
Later on, another one came up. Then later, after that, then I was getting just 1s and 2s coming, smaller ones moving, always moving down the arm, you know, so I'd had about 13 off in all, I think.
When yet another cluster of tumours appeared on Charlie Dawson's arm 2 months ago, his surgeon, leading melanoma specialist Professor John Thompson, knew any further surgery would involve removing half of his upper arm and was unlikely to work. Instead, Charlie Dawson's tumours were treated with rose bengal, a common industrial dye which Professor Thompson and his colleagues at the Sydney Melanoma Unit have been trialling on patients with secondary tumours.
Rose bengal was offered to him as an alternative to, you know, preserve the function of his arm and hopefully to kill the tumours without doing too much damage to the normal tissues.
It really does look as though you've had a very good response.
Just 4 weeks after treatment, Charlie Dawson's tumours had regressed to the point that 2 had gone completely.
I've never seen a treatment that in a group of patients has regularly produced good results, such as we've seen in Charlie. I've never seen that before.
Named after the dye Bengali women use as a symbol of marriage, rose bengal has been widely used over the past century for everything from cosmetics to insecticides. But after more than a decade of research by the American pharmaceutical company Provectus, it's only now the medical profession is beginning to glean its truly remarkable potential as a cancer treatment.
You can inject almost anything into tumours. You can inject drain cleaner into tumours and it'll kill the tumours, but it also damages the surrounding tissues. And the difference with rose bengal is that it appears to spare the normal tissues and just kill the tumour cells.
Professor Thompson says almost half the tumours injected with the rose bengal treatment, PV-10, disappeared completely, while another 30% either shrank or stopped growing altogether.
That rose bengal is not metabolised in the body.
The PV-10 also appeared to fire up the patient's immune system to fight the tumours, even destroying lesions near the treated site that hadn't been injected.
And keep breathing away on that gas. Probably, in the way we're using it at the moment, does not have an effect on ultimate survival. What it can do is make people's lives much more pleasant, and deal with tumours that are uncomfortable, that bleed, that ooze, and just make life a misery.
Just show me this. Where are these spots you're worried about?
Up here on my forehead, there's just 2.
Sydney melanoma specialist Professor Rick Kefford says, while the early results on rose bengal suggest it may be yet another weapon in treating the symptoms of melanoma, it's way too early to be hailing it as a wonder drug.
Yeah, I don't think you need to worry about that.
I think the developments with rose bengal represent another small step forward, but we are a long way off showing that that effect would translate into prolonging the life of people with secondary melanoma, and that remains our true holy grail with this disease.
At this early stage, no one's claiming rose bengal will save lives or even prolong them. But the pharmaceutical company Provectus says initial results were so promising they're now expanding their trials to liver and breast cancer. And it's that potential to treat secondary tumours inside the body that's really got researchers excited.
One of the exciting aspects of this is that it may be used not only for tumours on the surface of the skin and just under the surface, but in tumours that are located deeply within the body, such as in the liver or the lung or even the brain. It may be possible to give it intravenously so that it circulates through the body and homes in on tumours wherever they happen to be.
I think it's interesting. Certainly some of the results have been fairly dramatic. It's a case of watch this space.
But for Charlie Dawson, Rose Bengal has already delivered.
I don't really think about tomorrow might be the end. I sort of just keep doing things as though I've got an endless life, you know. And this is really just great, a great life I'm enjoying now. Yeah.